Now, once again, Raymond Arroyo.
Welcome back to The World Over. As the recent measles outbreak spreads across the United States, an old debate has been engaged. Do vaccines have harmful side effects, and whether parents should be compelled to vaccinate their children? The debate has even spilled over into the political realm, with presidential candidates Rand Paul and Chris Christie making controversial statements on the subject this week. Joining us to talk about the science of immunization and whether we as parents should be worried about the vaccinations we give our children is pediatrician and director of the Center for Clinical Bioethics at Georgetown University, Dr. Kevin Donovan. Dr. Donovan, thank you for being here.
Happy to be here.
Pleasure to see you. I want you to react to this, Dr. Kevin Donovan. This is Chris Christie and Rand Paul, two presidential candidates who really, I think, restarted this vaccination debate this past week. Listen to what they had to say and react, please.
Say is that we vaccinate ours, and so that's the best expression I can give you my opinion. It's much more important, I think, what you think as a parent than what you think as a public official, and that's what we do. But I also understand that parents need to have some measure of choice in things as well. So that's the balance that the government has to decide. But I can just tell people from our perspective, Mary Pat and I have had our children vaccinated, and we think it's an important part of making sure we protect their health and the public health.
I've heard of many tragic cases of walking, talking, normal children who wound up with profound mental disorders after vaccines. I'm not arguing vaccines are a bad idea. I think they're a good thing. But I think the parents should have some input.
Your reaction to that?
It's not that vaccines can't have side effects, and in rare, extremely rare instances, they can be severe. But he must have been talking to an extremely small group, because the vast majority of vaccines cause no severe problems at all. And the real concern here, that everybody seems to be missing the point, is that these diseases for which we are vaccinating can cause terrible problems.
Yeah, and had almost been stamped out. This measles explosion we're seeing in Los Angeles, surrounding Disneyland. Now there's a little cluster, 5 kids at a daycare center in Chicago, also an infection of measles breaking out. Measles can kill you, particularly children.
Measles can kill you, and measles is so easily spread. If 10 people were lined up and a kid with measles starts sneezing, 8 of them are going to get sick if they're unvaccinated.
Wow. Okay, I want to play this for you. Now, this is Savannah Guthrie talking to President Obama at the Super Bowl, just before the Super Bowl. And she asked him the question, should there be a requirement? Listen.
Do you feel there should be a requirement that parents get their kids vaccinated? Are parents who aren't getting their kids vaccinated endangering others?
I understand that there are families that, in some cases, are concerned about the effect of vaccinations. The science is, pretty indisputable. We've looked at this again and again. My children are vaccinated. You've got a new one at home. I'm assuming you're going to get them vaccinated. There is every reason to get vaccinated. There aren't reasons to not get vaccinated.
Are you telling parents you should get your kids vaccinated?
You should get your kids vaccinated.
Should there be a national requirement, a mandate that parents vaccinate their children, in your opinion, doctor?
Well, in fact, there is a requirement. There is a mandate. It's state by state, but it is national. And Obama is right. We should vaccinate our children. We should do it for our children's sake. We should do it for the people around our children who might be infected by them. And we should do it for those who cannot be vaccinated for medical reasons.
Now, you know what the problem is. Many parents have gotten this idea, received largely, and again, all the attention has been Chris Christie, Rand Paul, as if they started this thing. But when I did research this week, you really have to go back to 2007 when this became hip and kind of chic, when Oprah Winfrey gave her mega platform to Jenny McCarthy, who has been an evangelist on the anti-vaccination crusade. And I want to play you a little bite. This is Jenny McCarthy. I want your reaction because there are still a sizable number of parents who say, if I get my kids vaccinated, they could get autism.
Evan was diagnosed with autism in 2005. Without a doubt in my mind, I believe vaccinations triggered Evan's autism. We do believe, because we were the witness with our child, our firsthand witness after we came home from the doctor's office and saw this regression of a child that was perfect and then slowly fading away.
You would say what?
I would say autism is a terrible problem. We don't really understand the root cause of it. We know certain things don't cause it. You know, children get measles, mumps, rubella vaccine at a year of age. Her child got autism afterwards. She probably, like other parents, started feeding her child chocolate at a year of age. I don't think chocolate causes autism either.
What is the scientific research now telling us? I know there was just a report in December analyzing 1.2 million children. They found no connection between immunization and
Raymond,
autism.
you're so right. And the thing that you have to remember is that Jenny McCarthy, our scientific expert,
and Jim Carrey and Bill Maher and all the others who were peddling this idea, who vanished this week, by the way.
Right.
It's all politicians left standing.
Well, because we just exchanged comedians.
Yeah.
But all of this started with an article published in Lancet by a Dr. Wakefield, who was found to be fraudulently claiming that there was a connection. It was so embarrassing, Lancet withdrew the article. They rejected it. He lost his license.
Wow.
He is no longer a registered physician in Great Britain.
Yeah, and that was the big piece.
And he studied, supposedly studied, 12 children.
Yeah, nice big sample.
Exactly.
What about this idea, and I've spoken to some pediatricians this week, some parents prefer to space out these immunizations. So you don't give the one-shot booster, but you sort of space it out. You give them 2, rubella and measles here and mumps and something else over there.
Yes.
Is there a problem with that?
There are 2 problems with that.
Really?
And one of them is, I think if they asked the children, would they rather have 20 shots or 10?
Well, they'd like to have none, but...
Yeah, but the point is, by spacing them out, you are doubling the number of visits to the doctor's office, and you are giving them many more injections of the vaccines than they have to have. We know that the vaccines work well together. We know that they do not cause problems. In fact, probably are better together. We also know that by delaying it and spacing it more, that giving a child a late measles vaccine, for instance, may actually increase their risk from the immunization, their risk of things like seizures.
Wow, amazing. Dr. Kevin Donovan, thank you for being here.
My pleasure.
Thank you.